Good evening everyone and welcome to this very special bed sponsorship event. My name is Sue Hunt and it's my great pleasure to be the Chief Executive Officer of the Royal Children's Hospital Foundation. Welcome one and all. Can I begin by acknowledging the traditional owners of the land on which we gather tonight? For us it's the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and emerging, and any Aboriginal or Torres Strait Islander people who are with us tonight. I'd also like to welcome our presenters. First of all, Dr. Leah Hickey, who's Director of Neonatal Medicine at the RCH. Leah is a clinical senior lecturer with the University of Melbourne's Department of Paediatrics and an honorary fellow of neonatal research at the Murdoch Children's Research Institute. Welcome, Leah. Also joining us tonight is Peter Brown. He's the board chair of Strathmore Community Bendigo Bank, and he's a long-term donor, and the bank is a long-term donor and bed sponsor here at the hospital. Welcome, Peter. Thank you for joining us.
Thank you, Sue. It's a pleasure.
We're both very grateful that you take time out to be with us tonight so we can say thank you to our bed sponsors. Before we begin, ladies and gentlemen, just a little bit of housekeeping. We're live captioning the event tonight, so you'll be able to view that by clicking on the live transcript button in the menu bar below. Now, the captions are automatically generated, so they won't be perfect, but we do hope they'll be helpful to some of you who may need them. It's also an interactive session, so we'd love to hear from you this evening. There are plenty of opportunities for you to ask questions of our presenters as we go through the next hour. So let me begin by saying just how fortunate we think we are here at the Royal Children's Hospital to receive such incredible support from our community. We're delighted today to be able to bring you this event where we say thank you to you as a very important part of that community of support. We here at the Foundation and at the hospital as well are endlessly inspired by your support of this special program, especially as we've been navigating the challenges of COVID-19. And I know we've all been doing that together in our own different ways. And we're joining you here tonight not from the studio in the hospital, but from our fundraising resource centre. And you can see the magnificent view of our beautiful city of Melbourne behind us. We'd like to be able to bring you here in person, of course, because we love to be able to get together and break bread and have a nice set of conversations together. But of course, at the moment it's not possible, sadly, but we still want to express our sincere thanks and gratitude for your ongoing support of the program. By sponsoring the bed here at the RCH, you're ensuring that the hospital can continue to provide transformative care for the children who most need it. Now, of course, this program has grown significantly in the 14 years that it's been going. It started in 2007 as sponsoring cots in the newborn intensive care unit. It's the brainchild of Donna Irani, and many of you will know Donna, and I thank her so much for her passion when she began it and her passion that she stayed with all the time. It's grown today, of course, to be a hospital-wide program where beds are sponsored across all 12 of the wards. Today, we're going to focus on the impact that bed sponsorship has had on our newborn intensive care unit, or NICU as we call it. But please remember that the program does give you the opportunity to sponsor a bed in any of the wards that you might be passionate about. So that enables you to support a particular area of care at the hospital that has meaning for you. And we know that this is particularly true of many of our bed sponsors, including the Moralia family and son Luca, who are some of our most dedicated supporters of the NICU here at the hospital. Luca's been a patient here at the hospital since the day he was born. And in the words of his parents, Lisa and Robert, when Luca was born, his chances of survival were slim. Today he's thriving, and it's thanks to the doctors, nurses and all the staff at the RCH Newborn Intensive Care Unit. And they do say, we will never forget that. Now, I know that Robert and Lisa are on the call today and perhaps other parts of the family, so I welcome you. Thank you for joining us. Thank you so very much. And we wanted to be able to share their story just a little more. So we've put together a little video. We filmed this with them not so long ago, and I'd just like to share that with you now.
Our relationship with the Royal Children's Hospital began just over 13 years ago. Rob and I were excited parents to be, expecting identical twin boys. on the 9th of July 2007, our world was basically tipped upside down. Luca's brother, Alessio, died just hours before they were born, and Luca was in a very, very low state and wasn't given much chance. He was just a few days old when he was transferred to the Royal Children's Hospital. We entrusted them with all of our hopes to save his life. We had some very, very dark moments during that time. And the one thing we had that whole time was the comfort in knowing that everything possible was being done for Luca. And when you're feeling helpless as a parent, that is very powerful. The amazing work of that team enabled Luca to stabilise. And finally, at 6 weeks, we were able to take him home. As a family, we've faced a lot of challenges.
Not only do we find ourselves in the middle of this pandemic, we're homeschooling. I now find myself out of work. Luca's in need of a kidney. So from February this year, Luca and I were going through a workup through a preemptive transplant phase, with me being the donor. We were in the final stages of the workup when we received some heartbreaking news that I was no longer eligible due to a medical condition that I had some 20 years ago. And it was shattering, and it set us back quite a bit. But I have to say, the team at RCH were absolutely fantastic in the way they responded. Now, Luca's kidneys were at the end stage of failure. He needed to go directly into dialysis. The team quickly got us on the list, and a catheter was inserted ready to start peritoneal dialysis. We were in hospital for a couple of weeks, and during that time we started our training, basically on how to manage dialysis at home. And there's quite a lot to learn. The dialysis team were absolutely fantastic with their training, and we knew we were in good hands. At home now, we manage Luca's treatment. We have a dedicated storage place for all the dialysis equipment, and we set up each night. And I guess COVID halted a little bit of the treatment, but it was absolutely sensational the way RCH responded to us. And I guess we're so happy that we've got them to back us up.
The care was never compromised, and COVID was in the background instead of being the other way around. So it's just been remarkable, really. What started as a way of saying thank you really began when we were in NICU, and we decided that one day we would do something to show our gratitude. We'd always taken for granted that the Children's Hospital is always there for us, that there's always going to be groundbreaking research, there's always going to be medical breakthroughs, they're always going to have the top surgeons. But the reality is that the government funding keeps the hospital functioning, it keeps it going, but it's the philanthropy and the community fundraising that brings it up to that gold level standard, and the standard that we've all come to expect and rely on. The funds that we raise go towards supporting the Royal Children's Hospital bed sponsorship program. Luca's very proud of his sponsorship of a bed in the NICU butterfly ward, where his journey began 13 years ago. Whenever we go into the hospital, we always check out the acknowledgement board, and Luca will always look out for the Luca Morelli Foundation, and it really, gives us a sense of honour and pride to see that up there. So in his 13 years, he's been a pretty regular visitor to the RCH, and there aren't many departments that he hasn't been involved with or who haven't treated him. There's nephrology, audiology, cardiology, immunology, gastroenterology, physio, the list goes on. And so from these beginnings, it's quite incredible to look back and see where he is now. Hi.
I'm Luca, and I'm 13 years old. I want to say thank you to the hospital, the doctors and nurses, and all of the helping people like me. When I was a baby, I was really, really sick. The doctors helped me get better so I could come home. Since then, I have been back to the hospital for appointments and treatments well over 100 times. I don't mind going into the hospital. Everyone is really nice to me and I get to have time at school. I love seeing my kids around the RCH and being involved in the fundraising event so that I can help the hospital and other sick kids. I've had lots of challenges, but because of the excellent work the hospital does for me, I stay healthy and can do most things that other kids can do. This year, I got my black belt in Taekwondo. I passed my preliminary piano exam. I'm getting heaps better playing the drums, and last week I swam 50-metre butterfly. I would never been able to achieve all those things without the Royal Children's Hospital and all the supporters like you. Please keep supporting the Royal Children's Hospital so that it can keep making history and be one of the best kids' hospitals in the world. By doing that, you're helping kids like me to have the opportunity to be the best they can be. Together, we can do it.
Wow. Thank you, Lisa, Robert and Luca, for sharing your story. It's a truly remarkable story, and of course it's ongoing. And thank you for joining us tonight. Ladies and gentlemen, I'm really pleased to share that Luca will soon be undergoing a kidney transplant. And so we wish you, Luca, and the family all the very best as you undergo this next step of care. So to tell us a little more about the NICU here at the hospital and the impact of bed sponsorship from the clinical perspective, I'm now delighted to introduce Leah Hickey, who is Director of the Neonatal Medicine here at the hospital. Thanks, Leah.
Thank you, Sue, and good evening, everyone. So as Sue has said, my name is Dr. Leah Hickey and I am the Director of Neonatal Medicine at the Royal Children's Hospital. It is both a great pleasure and privilege to be with you all today to talk about the impact of the hospital bed sponsorship programme. I'd like to start by thanking Luca Moralia and his family for their ongoing support. It is so wonderful to see one of our brave NICU graduates become a philanthropist in his own right. There's no greater compliment that we could be paid than having a wonderful young man like Luca expressing his gratitude in this way. We really, really appreciate it. And I'd just like to add a note of congratulations on your Taekwondo black belt and on your 50 metres butterfly, which is very far to swim butterfly. Sue has already explained the origins of the hospital bed sponsorship programme, so tonight I'd like to tell you about what we do in NICU for those of you who might not know, and some of the ways in which this programme has positively impacted our patients and their families. In Butterfly Ward, which is also known as Newborn Intensive Care or NICU, we place the baby at the centre of everything we do every day. A typical day starts for us around 7 a.m. with the handover between the night shift nurses and the day nurses. And as the nurses settle into their day, they'll plan their tasks such as checking or changing equipment, administering medications, fluids and feeds, and undertaking or supporting their patient through tests and procedures. These tasks are planned around the routine of the baby and their family where possible, and regular baby care such as feeding, nappy changing and bath time are usually saved for when parents are present so that they can build their confidence in looking after their baby, just like they would at home. Medical rounds usually start around 8:30 a.m. and go through till 11 or thereabouts. And on these, decisions are made about what treatments or tests the patient will need over the coming 12 to 24 hours and what other specialist teams might need to be involved in their care. During these rounds, parents are strongly encouraged to be present and to participate in planning their baby's care. It also gives them a chance to share knowledge about their baby with our team, which we really value because nobody's going to know their baby as well as they do. Throughout the day, patients come and go from the operating theatre or other areas that they might go for tests, such as scans or x-rays, but they are always accompanied by fully trained staff and, where possible, a parent. On the ward, our team performs all of the usual jobs required in a busy ICU, like finding out test results and sharing these with families, inserting drips for medicines and fluids, and liaising with other teams, including those in the community, to plan for when the patients are ready to go home. We aim to have some quiet time for the babies during the day and lots overnight, when they can rest and recover from everything they must go through during their NICU experience. This is a critically important time for their brains to develop and grow so that they have the best chance of reaching their full potential in the future. Why does bed sponsorship matter? It matters because it means we can keep our sick and preterm babies safe and warm on and off the ward. It matters because it breaks down the barriers between parents and their sick babies. And it matters because we know when we walk past that sign on our way into Butterfly Ward that you have our back. We know you are there and that you care, and that helps us get on with what is often an emotionally challenging job, caring for some of the sickest babies and supporting their families through what is probably the hardest time of their lives. In literal terms, the bed sponsorship program has paid for a new fleet of these advanced hybrid infant warmer beds for NICU. These provide warmth and safety for the babies, and they open in a novel way, as you can see in the photograph on the right, that allows parents and staff to care for the babies without the old-fashioned cot walls getting in the way. Another really important and valuable project that has been funded directly from the bed sponsorship program is COCOON. COCOON stands for the Circle of Care Optimizing Outcomes for Newborns, and it is the model of care, that is, how staff provide care for babies and their families, that we've designed specially for Butterfly Ward. Babies are born ready to connect, engage, and learn, but illness and separation can seriously impact their chances of bonding with their families. This in turn can lead to poor neurodevelopmental outcomes for the child and mental health issues for their parents. Research shows that engaging families in the care of their babies right from the start can reduce these negative impacts of a NICU stay. When we first started planning our own family-centred care approach to Butterfly Ward, we worked with our consumers to find out how they were feeling at the time, and unfortunately the feedback wasn't very good. Here are a couple of the comments we received. I've been here 3 weeks and I don't feel like I've gotten to know my baby. I'm taking a stranger home. I was so overwhelmed I didn't even feel as though I could touch my baby. These and other comments made us realize that we had some urgent work to do. So following a thorough process of consultation with families, staff and other stakeholders, COCOON was designed by a team of experts, including neonatologists like me, infant mental health and allied health specialists, and parents. The aims of COCOON are to improve health outcomes for infants and improve the experience of families whose babies are cared for in NICU. Seeing the baby as a person in their own right with abilities to communicate their needs and truly sharing care with families are two of the main principles of this model. However, despite our best attempts to launch and support COCOON, we didn't quite manage to successfully embed it the first time round, so we had to go back to the drawing board. And in 2019, we applied to the Foundation to support the implementation of COCOON and the ongoing development of resources that would be required to make it a real success. We were very fortunate to be granted more than $300,000 to fund a full-time nursing position for 3 years to take on this challenge, and that has made all the difference. Jenna Rhodes, who you can see in the picture here, was one of our experienced NICU nurses, and she started as our first COCOON care coordinator in January 2020, and since then COCOON has gone from strength to strength. This very busy slide displays just some of the things that Jenna does to engage families day to day. In the interests of time, I'm not going to read through them all, but you can see that she's really developed this role, and I can tell you that families really love her for it. One of the first jobs Jenna as the COCOON care coordinator and myself as the project lead had to tackle was devising a plan to ensure that we were successful this time round. We went back to the start of the process and reviewed our original consumer input, as we felt that some time had passed. and we should repeat this process. And so we sought further consumer input and asked staff for their views on partnering with parents and taking on a mentorship role too. We then reworked older resources and developed new ones, which I will get into in just a moment. We are currently at stage 3 of the plan you can see here, having implemented most of the resources. We are now refining them to ensure that they actually are supporting families to involved in their baby's care right from the beginning. We are just about to start stage 4, in which we will share these resources with other units and departments across the whole RCH who care for infants and young children. There are 3 main prongs to the COCOON approach. These are family education, which includes a completely redeveloped COCOON website and My RCH app section. I'm very excited to tell you that we will be launching these in the coming weeks and are very happy to share them with the community. They contain lots of helpful information for families on how to care for themselves, how to get to know their baby, and how to care for their babies in a NICU environment. There are even some helpful videos on topics such as swaddle bathing and nasogastric tube insertion or position checking, which are skills that can help build confidence and competence in preparation for going home. Jenna also runs an on-the-ward parent education program several days each week, covering topics such as resuscitation and administering medicines to babies. Parent satisfaction ratings for these sessions are currently sitting at 97%. The staff education packages have been designed to teach all staff about the benefits of family-centred care based on the scientific studies in that area. They also include teaching on how to be a good coach and mentor for families and extensive information on how to provide care to babies in the best way to promote their development whilst in NICU. Staff can receive this education through online packages or in-person study days, and to date, more than 95% of staff have completed the online learning packages, and almost 100 staff members have attended study days. The last prong is the COCOON Care Bundle, which comprises many different elements, from admission packs with introductory information about COCOON and the ward, scent cloths for babies and parents to have the smell of each other when they're not actually there, and milestone cards. There's also a COCOON Huddle, which is a neurodevelopmentally focused ward round in which families can be taught what their baby can actually do now and focus on all of the positives rather than the negatives of the illness. And we've developed a PEEPS peer-to-peer support program where we link up parents of babies with similar conditions so that they have someone to share their butterfly journey with, who truly gets what they are experiencing. And parents are scoring these experiences very highly to date. As we've been implementing these resources, and Jenna has been cocooning on the ward, we've been seeking feedback from families to ensure that COCOON is having a positive impact on them. And I'd like to read you a couple of comments that show we're heading in the right direction. The nurses showed me how to do everything, and within a few weeks I did almost all the care. I am so thankful. I was always invited and encouraged to be involved with the care of my son, encouraged to be involved in all care from the very outset, and involved in NG feeding. This created lots of confidence prior to going home. We hope to be able to report even greater things in the future, including being able to use COCOON to support families to take their babies home earlier in a safe way than they currently can, which will not only have a positive impact on those babies and families, but will allow other babies and families to access the care that only RCH can provide. I'd like to thank you all so much for the opportunity to tell you about how your efforts and generosity pay off at the bedside for the people who matter most, our patients and their families. Thank you.
Thank you so much, Leah. Really appreciate it. It is fantastic, isn't it, folks, to see, I'm going to say that the tangible impacts of the bed sponsorship program, and that's absolutely right. Leah's shown us so many of the tangible benefits. But I think in your presentation, Leah, what really struck me beyond that is that you've talked about what we might say intangible. We talked about just how impactful it is for you and the team as well, and beyond the clinical, but also just when you said, when we see those names on the board, we know you've got our back. I don't know that families necessarily always kind of see that exchange backwards and forwards. So it's just marvellous to hear you say that. Thank you so very much. I'm sure everybody's terribly excited to continue hearing about COCOON and the future plans, and I know we at the Foundation are keen to hear about that as well as they develop, but also just later on this evening as well. So folks, start thinking about those questions. We're going, you can start putting them online if you like, but before we get to those questions, that's fair warning. It's my pleasure to introduce Peter Brown to you. Peter and the Strathmore Community Bendigo Bank branch have been, as I said before, long-term supporters of the NICU. And we're really grateful, Peter, to you, to the board, to all of the staff, and of course all of your customers who make it possible. So we're going to do a little Q&A session with Peter right now, and then after that, folks, it'll be your opportunity to ask some questions. So Peter, can I start by asking you to tell us a bit about yourself, the organisation, and what's motivated you to support the RCH?
Thank you, Sue. We've been now sponsoring her at the Children's Hospital since 2010. It's a pleasure and an honour to be able to do it. When you sit and listen to Luca's story and Leah's story, it's a bit humbling actually to be here. What motivates us? Those things motivate us. Personally, I'm semi-retired at the moment and I'm the chairman of the board. I joined our board, I think in about 2004, and I've gone through a secretary and now I'm chair. Our board consists of 5 people. It's been up to 8 at different times. All volunteers, we don't get paid, we just do our job. We hold the franchise for the Strathmore Community Bank. That's with the Bendigo and Adelaide Bank. That's where we get our income from, and that's where we get our money to give back to the community. Over our time, I think we've given back around $11 million back to our community, of Strathmore and the Children's Hospital and other places. We're very proud of that. Our shareholders are very proud of that. We have 280 shareholders, which are local people from our community, and that's where we are.
Great, thank you. And you started off by sponsoring 2 cots back. That was the first connection that we had with you, and you've grown that, and you're now sponsoring multiple beds. Sorry, go on.
Yeah, go.
I was going to say, how did you? Just for people's benefit at home, how do you raise those funds? How do you grow the support? What is it that drives that community engagement from the bank?
It's probably from our board and our directors. Our income, like I said, comes from the fees that the bank incurs. If they incur $1, we get back 50 cents. And out of that 50 cents, we run our bank and give back 80% to the community through the shareholders and with a dividend and other things. When we first started with the Children's Hospital, was back, like I said, in 2010. One of our staff members knew a nurse in the neonatal ward, Jess. I think Jess is still working there. That's how we first started, and we started with 2 cots. Oh, cots back then, not beds. So yeah, 2012 we went to 4. 2014 we went to 5. 2016 we did 10, and we also sponsored Fly for the Kids when Andrew flew around Australia, which was again an honour. And in 2020 we put it up to 16. And our aim one day is to have a bed in every ward.
Yeah, thank you. It's fantastic. And Peter and I have talked about this over the years a lot. We're we're kind of incredibly grateful for the depth of this partnership, not just that you've been with us and grown that support over the years, but just how much you want to work with us and how deep the relationship is, and we're really humbled by that, Peter, so thank you.
And it's a pleasure for us to be involved, Sue. And Donna makes it very much enjoyable too. She's been with us all the time, the journey, and it's been very, very good. It's just been tremendous and, like I said, humbling for us to do it.
Thank you. So tell us about how your team have responded. How do you keep them engaged with the program?
Well, it's not that hard, because if you look at it, there's probably nobody in Victoria that hasn't, or in Melbourne for instance, that hasn't had some sort of relationship with the Children's Hospital. I know myself, my son came here when he was 6, he got type 1 diabetes. He came here every 3 months till he was 18. So I have a relationship with it. And most people on our board, if it's not their immediate family, it's one of their relatives. So it's not that hard to do it.
Yeah, indeed. And so final question from me, what would you say to future potential bed sponsors if they're considering supporting the hospital? How would you say to them, this is important?
Just got to listen to Luca's story.
Yes.
That's what it is. I can't say much more than what he could. He's done a fantastic job, and he's your best advocate. So I come and I've listened to a few stories like that over the journey, and it's just humbling, and it makes you feel good to be able to do it. And our sponsored groups, we always get onto them about it as well to try and get them to become bed sponsors. We've had success with one little local football club. They sponsor a cot or a bed. I think it's up in the movement ward, I'm not sure. The Glenroy Football Club, and a little story out of that, one of their ex-presidents' daughter came, and they had a little child came here for treatment, and they came in and they saw the name of the football club on the wall of the ward they were in, and they said it gave them a great strength to come to realise their little football club was involved here.
Yeah.
So little stories like that, and we've had stories where people have used one of the cots in the NICU, and the names used to be on them in the early days.
Yes.
They saw our name, and they were from another community bank in Melbourne, and they sent through an email to thank us for doing it.
Yeah.
Not that we don't ask for anything like that, and we don't want anything for that. It's just a pleasure to be able to do it.
Yeah. I think it's really interesting when you say that, because I often use the expression that it's a community of support. So it's a community of practice. That it just keeps rippling.
Yeah.
And people want to be supportive, and that's what we're so lucky, of course, because we've had 150 years of that community support, and the stories that you're telling us now are just are in that 150 years and that incredible kind of sense of support that we're so lucky to have received. So it's wonderful to hear the stories now, but as you say, it's a story like Luca. It's Luca standing up on that video and telling his story.
Yeah, I could never say as much as what he can say.
Yeah, that's right. It's very true.
It just means a lot more coming from Luca and Leah than what I can say.
Yeah, so true, isn't it? Thank you both very much for sharing your insights with us. You certainly gave us a lot to think about. Peter, thank you for telling that story. It's your opportunity, folks, to ask some questions now. We're really excited to see them come through. So please type them in the chat function. And don't miss this opportunity to hear directly from Leah or from Peter if you have any questions about what it is to be a supporter. So while you're sending those through, I guess I can kick off just to get us started. Leah, can you, I kind of put this on notice before, can you tell us a little bit about the future of the COCOON program and where you'd like to see it go?
Thanks, Sue. As you've seen already, since we were fortunate enough to get the funds from the COT sponsorship program, we have developed extensive resources, and we're really now at the point of wanting to share those with anybody else who wants them, and we'll be starting with other wards across the hospital that also provide care for young infants in particular. So I guess that's the very next stage for us. It would be wonderful down the track to actually do some research into this area. We are measuring key performance indicators and those kind of measures as we go along to ensure that we're having a positive impact. But it would be nice to engage with other campus partners like the Murdoch Children's Research Institute and ensure that we've got some really robust measures so we can sit here in 2, 3, 4 years' time and say, look, we've proven that this has a benefit for parent mental health, for example, for reducing readmission rates to the children and the burden that comes with that for families. And for the hospital as a whole. We just want to prove that we're doing all the right things that families need. I guess in terms of other plans, I've just been in the job for a few months, so this is a planning stage for us, but something that we would love to do that fits in with COCOON, but we're probably a little bit behind on compared to other world-class centres is we don't have any within the NICU where families can stay and help deliver care to their babies. So I'd be very keen and would implore anybody out there who's on the brink of donating to consider donating towards revamping some of our space so that we can actually have true family rooms. At the moment there is accommodation provided on the hospital, but it's separate, and so parents can't stay with their babies 24 hours a day, and I think we've got some work to do there to bridge that gap. So that's something I'm very interested in looking at. And beyond that, we're very keen to build a NICU outreach program. So as I've said, there's lots of babies looked after across the Royal Children's Campus that if they don't need high dependency or intensive care, they're not looked after in Butterfly or Rosella, which is the paediatric intensive care unit for the cardiac babies. But they're spread across the other wards. And we'd love to be able to share our expertise, not just with Cocoon and family-centred care, but in other technical areas, or educate staff on those wards. And at the moment, we're not currently resourced to be able to provide that. So that's something else we're very interested in doing.
Thank you so much. One of the things I was reflecting on when we looked at Luca's story, the video, and doing the dialysis at home, it made me think of another program, separate from all this, that we have been delighted to support, which is the complex care program. And in you were talking, that a lot of things that kind of drove a model of care that Cocoon is seem to be about, how to start that journey in a way of kind of bringing all those complexities together to help the parent navigate. So there's that sort of complex care, and then also that kind of how do you support people to be at home. There's sort of two things in there, but I guess firstly, what is that? Where do you think that future of, we won't call it virtual care, but that kind of distributed care model is going to be, and how important can kind of putting the building blocks in place while people are still in hospital to be able to kind of stand on their own 2 feet in whatever's safe to do?
Hugely important, and I guess we do transition care to complex care, and that's been a really hugely beneficial service developed for families. Because we are what's called a quaternary level referral centre, so we get the sickest and most complex babies across the state and sometimes further. There are babies who are either born with, say, organs in the wrong place, for example, or they're born preterm and have additional issues like the need for surgery, so they come to us. And they're very complex patients because they may have a number of body systems involved, and so complex care play a hugely important role for those families in coordinating appointments for coming back to the hospital and making sure that they can sort of reduce the load of that, and then they provide a nursing care service. So when they're at home and they haven't thought to ask something through the education that we do our best to provide, they've got somebody at the end of the phone that they can build a relationship with. And I think that provides a huge amount of reassurance. And we do our best to link our families in with those services so they actually meet the people before they go and have the contact details. And I guess the other really valuable program is hospital in the home. So that's the sort of in between, when you're actually discharged and when you're an inpatient. And more we're trying to get our families set up for that. There are some limits about whether you're in Melbourne or further afield, but we can cut down a hospital stay by sometimes 2.5 weeks out of 3 weeks for certain conditions for babies who come in with infections. And you can imagine the impact of a family and the difference it makes to be at home for most of your care rather than in hospital. And yes, it's wonderful to have our amazing building and all of the resources we have and the expert care, but isn't it better when you can do it at home safely?
Yeah, indeed. And I think, folks, you could probably have heard that, as if you needed proof that we're in a medical precinct, you've just heard all of that behind Leah as she was speaking. And you mentioned Wallaby Ward, and of course, we're through the hospital and the home. Absolutely thrilled that we had a fantastic partnership with Islamic Council of Victoria, who supported Wallaby Ward through exactly this program, the bed sponsorship. So it didn't stand them in the way, it didn't stand in the way that it wasn't a bed. It wasn't a ward here in the hospital, that it was in the community and in the home, and they supported that with bed sponsorships for that. So I'm glad you mentioned Wallaby. Thanks. I've got one lovely, the Moralias have asked me to make this comment on their behalf, and then I have another question that I'll go back to. But Elise and Robert have said, Cocoon is such a fantastic initiative. We can see so many ways in which this will benefit babies and their families. I'm assuming this is the same, a follow-on as well. So Peter, you're amazing. From all of the babies and the children and their families that benefit from your support and compassion, our heartfelt thanks. You're making such a difference to many lives.
Thank you.
That's beautiful. Thank you so much, Family Moralia. So we have one question here, another question here, which I might pick up as well, which is there a set cost to sponsor a bed? Thank you so much for asking, Priyanka. And does that vary, depend on beds in different wards? So, ladies and gentlemen, it does vary sometimes. There's $5,000 to $7,500 a year, depending on the ward. And we do invite you to make a 3-year commitment so that we can get a bit of certainty when, NICU or other wards come along and say we'd like and need to kind of fund this new program. So we do ask for a 3-year commitment if you can manage that, of course. But we would always support you to do that which is meaningful for you and that which is that you're able to do. So thank you so much. Peter, I wanted to ask you, what is your long-term vision for philanthropy and for your involvement with the bed sponsorship program here?
Like I basically said before, we'll hopefully one day I'll get a bed in every ward.
Yes.
That's our aim. That might take us a little while. We're moving slowly. And also I will try to get more sponsorships from some of the football clubs that we sponsor. Because I believe a lot of football clubs out there could do it.
Yeah.
I don't think there's too many AFL clubs with their name on the wall here in your hospital, which is for $5,000 I think they probably could. And I don't think there's too many other banks with their name on the wall here at the moment, which they could, they should be able to.
Yeah. Well, thank you. I think it's a great vision. We'd heartily support that. Folks, we would encourage and support whether you're a family who has had an experience in the hospital and for whom giving back would be meaningful. We'd love to hear from you. And I guess also if you're a company, as in Peter's case, where you want to do either some employee engagement or you want to do something which shows your customers, your shareholders or your staff just how you're fitting into the community, bed sponsorship is a fantastic way to be able to do that. So we'd encourage everyone to do it.
Sorry, buddy.
Yeah, go ahead.
In relation to that, we sometimes have a shareholder function each year for our people, and we've had some of your doctors and professors come along and talk at it, and some of our shareholders have gone back to the bank afterwards and said that they don't want their dividend, they'd prefer it to go to the Children's Hospital.
Bless.
So it's just, very, very good to do something like this.
Yeah, thank you. I note we've got a comment here also that the Glenroy Football Club is a sponsor in Cockatoo Ward, which is neurology. So thank you, Glenroy, if there's anybody on the call tonight. And we've got a question about how do you recognise the donors. Fantastic question as well. So we recognise donors in our annual Impact of Giving report. We have boards at the entrance of the ward, and you saw a lovely couple of photos, I think, there of Luca pointing to them in that video. I think he pointed, look, it's a small screen here tonight, but I think certainly to the entrance of the ward, and also we have donor recognition boards that are across the hospital. So we recognise them in both those places. And we also invite you to special events which are like this event today. And when it's safe to do so, we hope to bring you back into the hospital, because there's nothing like actually being able to see firsthand where your money's going and what the contribution is that you're making. But yes, there's various ways that we try to show our thanks as well. We don't have any other questions right now, and we're getting sort of towards the end of the event. But I guess, Leah, you've said thanks, and you've shown us the impact you've shown us the impact again. If you had, if someone turned around and said, right, I'm going to sponsor every ward in the hospital, and I'd like to, give you $1 million to do that, what would you do with that?
Wow, that's a big question, Sue.
I know, it's a great question to think
I
about.
think beyond the things that I've described earlier, I'm very conscious that we need to lead the new generation of doctors and nurses, allied health professionals and other carers across the hospital. So I'd love to build a program of professional development above what already exists so that we can teach those people to truly partner with consumers in care in a way that I wasn't taught when I came through medical school, give them the building blocks to reach into the community and have that meaningful interaction, allow them to do groundbreaking research. So we look after a lot of conditions that are very rare and are hard to research, and it really takes commitment from donors to fund that sort of research. And it would be lovely to find some cures or better surgical techniques, better perioperative management for the patients that we have to give them an even better chance of coming through with their potential intact.
Thank you. So I think on that question, ladies and gentlemen, you can see there are no shortage of incredible ideas about how to improve this great hospital. And I think we always say that our job at the RCH Foundation will never be done while there are sick children, while there is great potential to improve the care for sick children or to cure disease. So I just wanted to give Leah that opportunity to show just above and beyond as well the incredible, not only passion, but smarts and vision that a clinician here at the hospital has. And nearly not every clinician, but so many clinicians are working closely with researchers or are working in research. And that sort of innovation is always developing here at the hospital. So you can be absolutely certain, I think, from that your children and young people are in really good hands, and there is a great vision for the future. Thank you, Leah and Peter, for such a thought-provoking discussion. Thank you, ladies and gentlemen, on the questions online. It's a terrific kind of conversation that we've been having. Thank you for both giving up your time generously to come in. I think we've watched the day disappear behind us, folks, so that's been pretty special as well. I just would like to reiterate, Peter, again to you and to everybody online just how thankful we are for your support of the bed sponsorship program that's working right across the hospital. I'd also just like to point out just how integral that support has been through the last 14 months and the challenges of COVID-19. Things were tough for everybody, and they weren't easy for donors in that first 3 months particularly, but right the way through. And I'm just so grateful. We're so thankful to all of our donors, particularly our bed sponsorship donors tonight, who have stayed with us and who have worked to adapt and keep their contribution coming to us during the challenges of COVID-19. And I guess it would be remiss not to say, Leah, that we recognise just how the hospitals had to adapt through this period of time as well. I've got a small idea, I think, meeting regularly with those folk who are adapting the logistics and the operations of this great hospital to accommodate it. So I can only imagine what the clinicians, our doctors, our nurses, our allied health professionals are going through on a daily basis. So thank you for to everybody for the hard work that, as essential workers, you're providing.
Thank you, Sue.
Oh, I've got one lovely comment here, which I'm going to stop what I was kind of saying and say, which has just been incredible. So this is from Kim. Seeing my newborn nephew in an intensive care bed was initially overwhelming. When I had a chance to take in the whole room, I realised the magnitude of equipment and support and care that was involved in saving him. There's so much more in sponsoring a bed than just the bed. And that is really true, folks. I think it's fair to say we try to capture support in a program by calling it bed sponsorship. But of course, it's actually everything else that goes around it. And most of the time, as you could hear from Leah talking about COCOON, you're actually supporting the people who stand behind those beds, who make those beds work. So you're actually doing that. You're supporting a model of care and the people who deliver it. And whilst we call it a bed sponsorship, It's actually that which you're being able to do, and that's the thing that really makes the care great. So thank you for that comment. I think that was a pretty fantastic summation of where we're at. So folks, if you would like to learn more about the program, including, we believe that there's some great team building benefits. If you'd like to learn more about how we recognise your support, our wonderful corporate engagement manager Kate Deere, or our equally wonderful philanthropy coordinator Philippa O'Brien here at the RCH Foundation are ready, willing and able to talk you through it. They'd be delighted to speak to you. We're going to pop their details in the chat function now, but of course you can find them, if that's too quick for you, you can find them on our website, and we would be delighted to talk to you. So just in almost in wrapping up, thank you again for your commitment to the hospital. We couldn't provide the world-leading care for our children and young people without your support. You've all been doing it as a community for 150 years, and for that, every part of this hospital is grateful. So thank you for joining us tonight, everyone. This brings us to the end of our evening. You'll be able to go off and have dinner now. But I would like to leave you with a short video of our appreciation. Thank you for joining us, everybody. Take care. And I look forward to speaking to each and every one of you as soon as we can in person. Good night. Hello, my name is Sue Hunt and I'm the Chief Executive Officer of the Royal Children's Hospital Foundation. Thank you so much for your dedication to sick children and their families. At times like this, your generosity is more inspirational to us than ever.
My name is Melissa Ananaya and I'm the Nurse Unit Manager on the Kelpie ward. I think the sponsors are definitely a big part of what informs and inspires us in our day-to-day work. I know a lot of the nurses, being a nurse manager, they often see the board obviously every day when they come to work, and I think it's just a really polite, gentle reminder that there's people that really genuinely care and want to continuously give back. It's really meaningful when you know people who have maybe had an experience with, whether it be our ward or another ward or just the hospital in general, and they've had such a good experience that they want to give back. I think that is really powerful and makes me feel really proud to work at this hospital. On behalf of everyone here at RCH, we'd really like to say thank you to our bed sponsors.
Thank you, RCH. Thank you for sponsoring our bed.